Okay, welcome everybody to Health Info today. Our guest speakers are Dr. Cranton and Hilton, and they'll be speaking on a number of topics, and the floor is yours.
Thank you. So, like I said, or like you said, my name is Hilton. I attended university here at Lakehead with a kinesiology degree. And my other laser background, I worked at the laser clinic that focuses mostly on the acupuncture points for smoking cessation and weight loss, as well as addiction treatments. On the other side of that, hair removal and tattoo removal as well. So I have a broad spectrum of the laser, background. But with this laser, I enjoy a lot more because it's the pain management aspect, helping people with conditions that can be treated, but a lot of times go untreated. And that's what's great about this is because they can get treated very quick and fast and easily, pain-free, non-invasive. So basically, it's a really exciting field to be in right now, what they need. And like I said, this is where I have my background before I worked at the Cranton Wellness Center was with the smoking cessation and the weight loss treatment. I mean, you can quit smoking in an hour, which is a pretty magnificent thing considering, yes, it is still, it's still a struggle where you have that psychological addiction if you've been an adult, and a smoker, you've probably never been an adult and not smoked. So it's going to be, still a journey that you have to take. But with the laser treatment, you have no physical withdrawal symptoms. So that makes it a lot easier to break that habit when you just have to take away your triggers, right? The weight loss treatment, it kind of, it decreases appetite, but it also stimulates the, metabolism to increase some of the functioning. Obviously, people who are overweight, the functioning of the body isn't at its optimal ability, so it kind of triggers those systems that are lacking to kickstart, basically. So all tissues can basically benefit from the laser. The skin, the subcutaneous fat, the muscles, the tendons, bones, joints, whatever area is stimulated, that is the area that is affected, basically.
Membrane transformation. When a cell membrane, like in a nerve cell, is not functioning very well, it's hard for the nerve to transport the ions from the inside of the nerve cell to the outside of the nerve cell, and that's how a message is sent along a nerve. Well, if you are dealing with pain nerve endings, and these are constantly being stimulated because the cell can't balance the ions from the outside of the cell to the inside of the cell, you're going to be getting a constant pain message to your brain that the knee, the back, the hip, the elbow, the wrist, the whatever is in a constant state of pain. By putting the laser on there, it changes the membrane's ability to transport nutrients in and out of the pain nerve cell, and therefore all of a sudden, boom, the pain just starts to go down. And Erica, when we get to the end, she'll tell you some stories about people that have had pain for ages and seen dramatic changes a lot faster than we ever expected. But I'll let her keep going.
So the secondary mechanisms within the biological consequences of it, the initiation of proteins and cytokine synthesis, the increase in bactericidal activity.
So the bactericidal means the death of bacteria.
So getting all that stuff over there. The activation of cell proliferation. So again, the increase in the number of cells in the area. So the kind of the third end of the spectrum, basically the outcome that we're looking for is wound healing, pain relief, and immunodilation.
Immunomodulation.
Modulation.
Everybody knows that word, right? It's modulated, or it modifies the immune system to function better.
So this is just a breakdown of what I said into
chart form.
So wound healing, acceleration of inflammatory processes, and the influence of pain.
Now you want to accelerate the inflammatory process because the inflammation is there for a reason, to go in, stimulate blood flow, break down broken down tissues and get it out of there. You don't want to stop inflammation. You want to actually help the inflammatory reaction to function better. And it functions better by increasing blood flow, decreasing the pain. The increased blood flow, decreased pain, get more mobility into the area, it's going to heal a whole lot faster.
So how laser therapy works. The light from the laser penetrates the tissue where the light energy is then converted into chemical energy. The mitochondria is stimulated to produce more energy and repair damaged tissues then occurs. And basically the production up to 700 times more nitrous oxide for vasodilation of the capillaries compared to 0% from the placebo and continuous wavelength laser. That's, we're using the pulsed one, and compared to the continuous, it's 700 times different. So it's a huge number. The benefits of how or why it works. It decreases, eliminates pain, reduces inflammation, promotes new blood vessels and tissue growth, promotes nerve axon growth, faster wound healing, increases blood flow to an area, greater production of cells in the area. Just on that promotes nerve axon growth, they actually did a study, where they severed a mouse's spinal column, and it actually, when they basically induced it to laser, actually regrew nerves in its spinal column. So I mean, it's pretty amazing stuff that they're doing out there, and that just kind of shows. I mean, our bodies are much more advanced than theirs, and if they can regrow nerves, then I believe we can too.
They're a little reluctant to do human experiments just yet.
Yeah.
But it is, no pun intended, on the cutting edge.
So these are some of the protocols. So we are FDA approved. Most of the research was on knee pain. They've had great results everywhere from osteoarthritis or people who torn meniscus. Everybody gets some sort of knee pain throughout their lives. And from this, the recommendation is 10 to 12 treatments. For example, it's 3 minutes, and it's at milliwatts of 50, so out of 100. So I mean, 3 minutes for 3 to 4 spots. You can do all of one knee or 2 shots per knee, whatever the individual needs, basically. But some people notice a difference in less than 10 to 12 treatments. Some people who have had osteoarthritis for 10 years may need 15 to 20 treatments.
Do you have any stories that had some pretty amazing results with these?
Yeah, actually I have a couple written down here. I mean, I see. Well, one lady came in and she already had one knee replaced, so she was trying to postpone another surgery. I believe she had 6 treatments on her knee, and she was going on her walks again. She was bending down and doing gardening. She had just was doing all those things that she had gradually cut out of her life due to her knee pain, and it was something that she didn't have to live with. It was something that she could start doing all those things again just by, 2 weeks of treatments. So I mean, that was, some people need more than that. Some people don't even need that. I mean, if you came in and got knee pain yesterday, you might only need less than that. So it's on an individual basis.
Does anybody have any problems with their knees?
A little bit.
Yeah. Does anybody know anybody else with knee problems? So get a bunch of Erica's cards when you leave and say, go and see her.